Hello, all. This is Taylor Wisdom, and I'll be covering the Surgeon General's call to action to support breastfeeding. And I apologize for not being able to do this in person. This is the best substitute I can do at the moment. So I'll begin with the importance of breastfeeding. So when people think of why breastfeeding is important, mainly people think about the health effects. So they apply to both mother and child. Breast milk is especially made for infants, and it also offers protection against different diseases. It contains both anti-inflammatory and immunological properties such as antibodies. So for the mothers, breastfeeding can potentially protect against ovarian and breast cancer. So some observational studies showed that the excess risk for ovarian cancer and breast cancer among women who didn't breastfeed was 27% and 4%. And then for infants, I made a table, there's excess risk for a lot of different conditions if they are not breastfed. So I guess you can read there's acute ear infection, eczema, diarrhea and vomiting, hospitalization for lower respiratory tract diseases in the first year, which has a really high excess risk, asthma, childhood obesity, type 2 diabetes, different leukemias, and also SIDS. I'm sorry for moving this around so much. Okay, so the psychosocial effects. Breastfeeding creates a sense of closeness between the mother and child. So, when breastfeeding, there's the skin-to-skin contact, which I guess helps create that bond. Women have reported that it helps them bond with their infant. Some studies suggest that it can help women cope with postpartum depression. So as for the economic benefits, so the families not buying formula can save anywhere between $1,200 and $1,500 in the first year, which is a pretty good incentive for a lot of families to breastfeed. And also because breastfeeding lowers risk for different infections, parents don't have to take as much time off from work to care for their child, so they save money in that aspect. A study in 2001 showed that $3.6 billion could be saved annually if breastfeeding rates reach Healthy People 2010 goals. And I'll talk about those goals later. This is based off formula cost, medical cost, and the wages lost due to taking time off for a sick child. And another study showed that $13 billion could be saved annually if 90% of families breastfed. As far as environmental effects, so breastfeeding can reduce use of material waste, such as the containers that it comes in, which is a lot of plastic, and usually ends up in a landfill. So per baby, there's 150 containers of formula used. And there's also a reduction in the use of resources, such as the energy needed to produce the formula or the packaging, and also the transportation to take it from factory to store or wherever. Okay, so endorsement. Breastfeeding is backed by a lot of well-known organizations, such as the American Academy of Pediatrics, American College of Nurse Midwives, American College of Obstetricians and Gynecologists, and American Public Health Association. They all recommend that babies be breastfed for at least a year, and exclusively fed breast milk for the first 6 months. And there are exceptions to this. Women with HIV/AIDS, human T-cell lymphotrophic virus type 1, TB, herpes lesions on the breast shouldn't breastfeed, as well as women like receiving chemo or radiation therapy, or just women who are on drugs. They should not be breastfeeding either.